Hello, everyone. Welcome back to the Push Podcast.
Welcome back.
I'm Sydney.
And I'm Megan.
And today we're doing a mini episode, a very special mini episode on substance use and breastfeeding.
This is like an emergency mini episode.
Emergency.
Like
that's such a good way of putting
the
it.
people have spoken. You would like more information about this. Sydney, I have to say, I did not anticipate the clip of us talking about alcohol and breastfeeding going so extremely viral.
Yeah.
This is the first time I've gone viral. I did not know what to do.
How do you feel after your first experience going viral?
A little disoriented. Very happy that it resonated. I have to say, it was so heartening to be seeing so many comments of individuals and moms saying how heard they felt, how reassured they were by the information that we were providing.
Yeah.
A few people saying things like they'd never understood it before, but now they do. And that is so
huge.
Incredible, right? It's like, that's why we started the podcast,
That's why
right?
we do this. Yes.
But I think in many ways, I've also never felt so misunderstood in the sense that there were a lot of people asking a lot of questions that for me were just kind of like, whoa.
That's not what I meant, taking it out of context. This is not what I meant.
This is not what, and again, this is like, I can't emphasize this enough. If anybody is finding us here after seeing that clip, like, first of all, we stand by the clip. The clip is evidence-based. Like, Absolutely. It is what it is.
Yeah.
But please listen to the episode Beyond Breast is Best of our podcast, because this was one small thing that we discussed in a much broader episode that talked about breastfeeding in general.
Yes.
And I just think it's an episode that's so rich, full of, information that is helpful.
Yeah.
Outside of just this kind of one snippet about alcohol.
Yes. But please go and listen to it.
But listen, I also get it, right?
Yeah.
I'm wrapped in all of the kind of controversy back and forth.
Yes.
Were a lot of really meaningful questions about alcohol and breastfeeding in general, but also about other substance use, right?
Yeah.
And I made a couple of videos responding to them, but then ultimately, like, I could not keep up. I don't know about you. Like, we could not keep up with the amount of comments.
At one point, but it was just, and it was also in the midst of we were just launching the podcast.
Yeah.
We were still familiarizing ourselves with how to go about stuff. I was in the midst of wedding planning, and the wedding was a couple of weeks out. She was moving. It was long. But besides the fact, we are here to talk about it more, because if you guys are passionate about topics that we talk about here on the Push Podcast, we are happy to continue to talk about it and to explore it even more.
We can make more SOS emergency mini episodes on topics that you guys are finding particularly resonate with you.
Absolutely. So let's break down, the evidence a little bit on alcohol, nicotine, and then cannabis and caffeine specifically. Those are the four things we're going to talk about, because I think that's the biggest source of anxiety and misinformation online of like what substances are safe to have when you're breastfeeding, right? Yeah. And I do kind of want to make this extra clear before we kind of dive in that we are not speaking about, drinking alcohol or using these substances during pregnancy.
No.
That's I think some people got a little bit confused from that clip and they thought we were advocating for for people to drink alcohol during pregnancy. That is absolutely not recommended. The CDC, ACOG, and Health Canada all state that there is no known safe amount, type or timing of alcohol use during pregnancy. So just keep that in mind. We are talking about breastfeeding specifically because, anyways, continue. Why don't 100%. You start?
Similarly, I do not advocate drinking and driving.
Yes.
Which was another thing that I found myself having to defend in the comment section.
Where do people get this? Like, where did they
Please
think
don't drink and drive.
We are not advocates for that in any way, shape, or form.
No. Okay, so in brief, for those that didn't...
I don't even drink. I'm just going to put that out there.
Honestly, that's the funniest part about being this, having found myself at the center of all of this controversy, is that I'm also not a big drinker.
But it's okay if you are. We're just
judgment. No judgment. It just is a very unlikely mantle that I have taken up in all of this. But nevertheless, As a briefer to anyone who hasn't seen the aforementioned viral clips, or listened to the Beyond Breast is Best episode, number one, what are you doing? Go listen to the episode.
Yes.
And then come back to us here. But anyway, in brief, the discussion that we had at hand was that we have kind of moved away, at least in the literature, from the previous recommendation, which was to wait 2 hours after breastfeeding wait 2 hours after drinking before breastfeeding your baby. Now, a lot of commenters were correct that remains the recommendation from a lot of major health organizations, right? And I can't really comment on the reasons for that, right? Yeah. Nor am I suggesting that anybody drink and breastfeed, right? My job is really just to present the information, the evidence as it stands.
Exactly.
And so when you have one standard drink for an average sized female-bodied person, typically one drink will increase your blood alcohol content to 0.01 to about 0.02%.
Yeah.
Now, what is interesting about the way that alcohol is metabolized and the way that it interacts with your breast milk is that it passes very quickly and very transparently into your breast milk.
Yes.
And what that means is that when your blood alcohol content is 0.01 to 0.02%, your breast milk alcohol content is also 0.01 to 0.02%. And so that is really a minuscule amount of alcohol in the breast milk itself. And that's why ultimately, much of the evidence suggests now that there's no evidence to suggest that that is harmful to a baby, especially in an occasional kind of context. Now, you don't have to breastfeed your baby after drinking if you don't want to, but what my recommendation really was at the end of all of this is don't pump and dump, right? Pumping does not increase breast milk alcohol clearance in any way, shape, or form. Right?
Yeah.
And so
it's an old recommendation.
It's an old recommendation. And so that alcohol should clear from one drink, should clear from your breast milk in about 2 hours. And so that's where that 2 hours comes from.
Yeah.
It's the time it takes for one drink to clear from your breast milk.
Yes.
And so don't pump and dump. It's not going to make that process happen any faster unless you cannot make it to the 2 hours without feeling engorged or uncomfortable, of course, right? Like if you're pumping for your own comfort, that's one thing.
Yes.
If you're pumping to try and enhance the metabolism of alcohol, that's just not the way it works.
Yep.
You just need time. Time is the only way to prevent that.
Yeah. So the online myths of just pump and dump and it's fine are not actually true.
Yeah. Exactly. Now, some people suggested in the comments that babies' livers are much more immature than an adult liver is or than a child's liver is. And that is correct, actually, right? Yeah. But I think as with so many things in medicine, the nuance is important, right? Yeah. As well as the follow-up questions that we ask with this kind of information. Those facts can be correct, but I think the important thing to ask is there any impact, right? And is it meaningful, right? With respect to overall health or outcomes. So certainly when the baby is in utero, they have almost no activity of the major enzyme that processes alcohol within their liver. Also in utero, your baby has a direct line of alcohol if you are drinking from your blood through the placenta to baby, and it's sustained. It's not just being ingested once, it's sustained ingestion or sustained transfer during the time in which your blood alcohol content is high.
Yes.
And so that is why the mechanism is different in pregnancy.
Yes.
And why we have no known kind of safe amount that you can be drinking during pregnancy in order to prevent or to kind of guard against impacts to baby. And those impacts to baby often are, first of all, in organogenesis. So in early stages of pregnancy, when the organs are developing, they're also neurodevelopmental. Right? Yeah. So they can have major cognitive effects on baby, particularly when alcohol is at high amounts, so binge drinking amounts, or when the use is sustained or continuous over time.
Yeah,
right?
Which can lead to the fetal alcohol spectrum disorders and all that kind of stuff.
Exactly. Now, when baby is born, baby does have some activity of that enzyme. It's about 50% of the activity that an adult would have, but baby's liver is working, right? And again, I'm not an advocate for drinking and doing and drinking in general, right?
Yeah,
but drinking and doing anything necessarily. But again, I think it's important to note that
and to talk about,
irrespective of the fact that babies have immature livers, right? Which is like kind of a factoid tossed around that is true at the face of it.
Yeah.
Right? There is they do have activity of that enzyme, and there's no shown with occasional moderate drinking. There's no known effect or no demonstrated effect to baby.
Yeah.
Now, I will say in that newborn period, right, when baby's liver is at its most immature, we're talking about kind of very conservative quantities of alcohol with respect to what we know about it. And so certainly caution should be applied even with breastfeeding for heavy, consistent drinking during the newborn period.
Yeah.
I think we just don't have the information to suggest how harmful, how safe that is or how harmful it is.
Yeah.
It may be that there's no effect, similar to what we found with much more casual or moderate use.
Yeah.
But it also may be that there's some subtle effect that we're not quite able to elucidate yet.
Yeah, that makes sense.
So that's kind of the nuance around that picture.
Yeah.
Okay. The other thing that I want to address with respect to questions and comments around this clip, a lot of people took issue with the comparison to apple juice. So in the episode, we mentioned that apple juice frequently has a alcohol content that is as high as 0.6%, right? And we even then followed up with a carousel talking about the alcohol content in other foods.
Yes.
And a lot of people took issue with the comparison because they suggested, and rightly, that no one was feeding newborns apple juice, right?
Yeah. Yeah.
So let me be clear. If I was not clear previously, I don't recommend you give juice to your newborn. We know
not even
that.
water. Water's not even safe.
No. We don't recommend these things for newborns because their nutritional status is best upheld by formula or breastfeeding, right?
Yeah.
However, the comparison, what the purpose of the comparison was and what it served from a logical sense was to remind us that alcohol is a natural byproduct of fermentation.
Yes.
And many common things that we ingest and that older babies and children ingest without any thought may have a higher percentage of alcohol content. We've again kind of addressed the newborn and infant capacity, right, to process things like alcohol. But again, alcohol in and of itself in extremely small quantities, as would be present in any of these things, is present in our daily lives.
Yeah.
A lot of people brought up as well that alcohol is a toxin. And
it is.
Yeah. We know this. We know this. Drinking is not something that is ultimately good for us in large quantities, right? But again, when we're talking about the consequences of adult alcohol consumption, right? Even at moderate amounts over time, and this is all of the consequences of that are beyond the scope of this podcast.
Oh, yeah.
We are not also including apple juice, right? Like we're not including the range of like food level alcohol that is present in other things.
Yes, exactly.
Yeah. And so we have no reason, nutritionists, correct me if I'm wrong. We have no reason to think that those food grade levels of alcohol in things like soy sauce and vanilla extract and sourdough bread are having any negative consequence to our lives as adults, nor do they as children. So that's what I'll say about the alcohol misconceptions.
Yes.
But thank you for the engagement on the post. It gave me lots to kind of address. I wish I'd had the opportunity to answer everything directly.
I know.
But it was just far more than this social media novice was expecting.
It's a lot, but when you get a viral video with all those comments, it can be overwhelming. And this was kind of our way of putting out like more clarification on the topic.
Yeah. And if you need more clarification, please ask us.
Yeah.
Just you give me 5 to 7 business days to reply.
We're trying, guys. Okay, let's talk about nicotine and smoking because we got a lot of comments asking about smoking during breastfeeding and how that impacts your breast milk and if it's okay. So let's talk about it.
Yeah, absolutely. So nicotine also does pass readily into breast milk.
Yeah.
The levels peak about 30 minutes after use, and that's whether you're smoking or vaping, presumably also for the chews and things like that are now available.
Oh yeah, what is that called? Zins. Zins. I've seen, I don't think they're legal in Canada, but I saw them in Mexico on my honeymoon.
Interesting.
Fun fact. Anyways.
Maybe that's why I didn't know what they were. I did literally have to Google that when somebody asked about it.
I don't think they're legal in Canada. I could be wrong.
Yeah, I just thought it was because I'm a millennial.
Oh, I don't know. It's okay. I'm on the cusp.
Too old for this.
I'm on the cusp of being a millennial, so I didn't know what they were either.
So levels peak regardless of mode of ingestion within about 30 minutes, and the duration of the clearance is about 3 hours. So cigarettes specifically contain nicotine, yes, which is kind of the compound which we know the most about its impact on like neonatal development. Plus, though, thousands of other toxic byproducts, right? As well as combustion byproducts, things like carbon monoxide, tar, volatile organic compounds, heavy metals, and known carcinogens, right? And we also know that secondhand and even thirdhand smoke are linked to an increased risks of things like SIDS, of asthma, bronchitis, pneumonia, and ear infections in infants.
Not good.
Vaping, conversely, like a little bit better in the sense that there's no combustion, right? So it certainly contains fewer toxicants than cigarettes, but it does still contain nicotine, as well as ultrafine particles, heavy metals, and some other volatile organic compounds. And long-term safety data as to the difference between these two things is obviously limited. We don't have that information right now. So with respect to the impact on breastfeeding, again, most of this information is with nicotine specifically. So nicotine may actually reduce milk production. It also has the potential to alter fat or protein or calorie content of breast milk and decrease the immune and antioxidant properties of milk. Smoking and vaping is also associated with shorter breastfeeding duration, although the reasons for that are not necessarily fully elucidated. Nicotine exposure in early life may affect neurodevelopmental as well as lung development. But right now, as it stands, the American Academy of Pediatrics doesn't actually necessarily recommend avoiding breastfeeding if you smoke as well. It's much more focused on risk mitigation, right? And risk minimization. So usually what we recommend if you're unable to quit smoking is to feed first and then smoke or vape immediately afterwards to allow as much clearance time as possible before your next feed.
That makes sense.
We also don't recommend smoking or feeding or smoking or vaping while feeding, right? Or in the home or in enclosed spaces like cars. And that's, again, that secondhand risk of smoke exposure. Change clothing after smoking to reduce third-hand smoke exposure. And encouraging nicotine replacement therapy where appropriate is also recommended.
Yeah, that's okay. Like, let's quit the shaming. There's a lot of stigma online. Us as your providers, we're here to help you. And if quitting smoking is what you would really like to do, whether that's during pregnancy or postpartum, there are things we can do to help you, right? There's things like the patches, the nicotine gum, all that kind of stuff. And we're here to support you through that process. We know it can be challenging. And it's better to be honest and upfront with these things and tell us your goals so that we can better assist you with that.
Listen, substance use of all different things is a complex issue, right? If we're talking just about medical outcomes, not smoking is certainly better than smoking from the perspective of breastfeeding success as well as for infant health, right? But currently we still think that the benefits of breastfeeding exceed the risks of smoking while breastfeeding at this point. And so recommending support while doing so. And again, risk mediation is the next best step from a nicotine perspective.
Okay, now that we've talked about nicotine, let's move into cannabis and marijuana use. So that's kind of still smoking, but also, I mean, edibles and all that kind of stuff. We had a lot of comments.
A lot of comments
asking about it. I mean, in Canada, it is legal now. I think more people are choosing to smoke marijuana and all that kind of stuff. So maybe like this is a question that a lot of people have about breastfeeding that you know, they're not sure if they should continue doing it or not, right?
I actually find increasingly, and this is anecdotal, but I'm curious to see like sociologically whether it's true or not, that like California sobriety is becoming more and more common, right? So people are abstaining from alcohol, but using marijuana and cannabis, right? So part of the crux of why our recommendations are different with respect to THC and cannabis is on the essential differences in the pharmacodynamics of it. So THC is fat soluble as opposed to water soluble alcohol, right? And what that means is that it doesn't just pass kind of freely in and out like alcohol does of your breast milk. It actually accumulates and it can linger there for days or weeks.
Yeah.
And so it is, if you have a drink, again, your breast milk clears as your alcohol level drops.
Yeah.
But that's not what happens with THC. So long after you stop feeling the effects, you do still have THC accumulation in your breast milk. And that can also compound over time, right? And so if you're using kind of daily or even every few days, we know that just from one use, THC can be present in breast milk for even up to 6 days afterwards. And so if we're using more than every 6 days, then that becomes really impossible to ascertain how much THC your baby might be getting. So it's a little bit less clean of an assessment of risk exposure, right? The other thing too is it can concentrate in milk, right? So it can accumulate and it can actually be 8 times higher than the levels in your bloodstream because of that fat solubility.
Yeah.
Okay. And so that is why, again, THC, that it's not that we're more judgmental about it. It's not that the science is more judgmental about THC use. It's just that it's functionally practically different with the way that it interacts with your body.
Yep. And we would be the first to tell you if it was safe, but like right now, the evidence, as you said, it's fat soluble.
Yeah.
It's going to go through to your breast milk. So it's not safe. Now there are a lot of like conflicting anecdotes online of people saying, well, I smoked weed when I was breastfeeding my baby and my baby was fine. Just keep in mind, those are individual situations and what we're recommending is what is evidence-based at this time.
Yeah.
So
I think the thing as well, I mean, number one, I did X and my baby was fine or I was fine is a classic example of survivor bias, right?
Yeah.
We think that because something didn't impact us, that it must not impact everyone.
Yeah.
But research necessarily is not concerned with one individual, right?
Yeah.
Research has to be concerned with a population, has to be concerned with everyone so that we can really begin to ascertain what is the risk, right? Yep. Is the risk very low and most people will be fine, or is the risk really high and you were just lucky, right?
Yes.
And so that's again what the difference is here with respect to personal experience versus what the data shows. The other thing that I would suggest is that with respect to THC and cannabis, the possible impacts on infant development are subtle because it's like motor development, it's behavior and language development that we are seeing some signs could be impacted or delayed. And that's not something that is always it takes time to develop, it takes time to reveal itself. And it's also not as cleanly quantifiable as like something that you can say you developed like disease X, yes or no, right? Like this is development and behavior on a spectrum, which is inherently a little bit more difficult to study and to self-assess, right?
Yeah. Sure.
There's also been reports of poor feeding or increased sleepiness when infants are exposed through milk. So we're still learning, but the early brain is very sensitive. Again, this is I realize this sounds, contradictory as we've kind of reassured people about the safety or relative lack of harm with respect to like small amounts of alcohol use or moderate amounts. But the difference is really in the way that it's processed in our bodies. THC compounds, it lasts for longer, it increases as opposed to just being stable with respect to your own impact. And that makes it, certainly more concerning from this perspective of child development. So because it can build up, it can stick around for days. We do not recommend THC in breastfeeding.
Yep. Okay, let's move on quickly to caffeine, because caffeine, I feel like, is actually a substance that we need to talk about, right?
So many people asked us about caffeine.
Oh yeah, and I get it. Like we need our caffeine, right?
Oh my gosh. I think one person commented like, listen, I don't care about drinking, but like I need my coffee. And honestly, girl, same. Like I especially in those early days, especially as a new mom.
Goodness. How do you survive without it?
Yeah.
Good news is you can have some. It is okay to have some.
Yeah.
It doesn't transfer into breast milk. Well, only in small amounts, right? So
it does. And it's in proportion to maternal intake. It peaks a couple of hours after consumption and clears slowly. And newborns do metabolize caffeine more slowly than older infants and adults.
Yeah.
But the thing is, as well, is with low to moderate use, again, we're not seeing consistent signs of any poor impact to babies, right?
Yeah.
The expert consensus right now suggests that we should limit all total daily caffeine to about 200 to 300 milligrams per day. So that means 1 to 2 mugs of coffee or 3 to 4 cups of tea or 1 standard energy drink. Now, at very high levels, there is some data to suggest poor possible irritability, poor sleep, more frequent night waking, or rarely things like colic or eczema flare-ups. But the data is actually a bit contradictory on that. And we don't have a clear definition of what like high level of intake is.
Okay.
Interestingly, there's no effect on milk supply or hydration.
Oh, interesting.
And there have been some systematic reviews and large scale assessments that have looked to see whether caffeine intake decreases milk supply or causes maternal dehydration. It has not been found to do that.
That's cool.
Now, with respect to energy drinks, as we mentioned, the caffeine level in one energy drink would basically be your daily recommended intake.
Yeah.
But I think the concern with energy drinks is just that they contain a lot of other things.
Yeah.
Right? A lot of other chemical compounds like taurine, which may be active as well. And we just don't have safety data for those.
Yes.
So at this point, most professional bodies do recommend avoiding energy drinks while breastfeeding, not so much because of the caffeine component of it, but because there are other active ingredients that we don't have safety data for. Again, this may mean that it is fine, but more studies are required before we can make a confident assessment and recommendation on that.
But you are okay to have like your normal intake of coffee. Usually like your normal intake, 2 to 3 cups of coffee a day. You're fine. So
So basically the recommendation right now is in minimizing exposure, right, to infants, to drink caffeine-containing beverages right after breastfeeding and avoid large doses in the 4 hours before the next feed. Because again, we're kind of banking on, similar to alcohol, if you wanted to allow it to pass out of your breast milk, we're looking to allow the caffeine to pass out of your breast milk if possible before the next feed. Now, I will say with caffeine, I feel like caffeine can feel particularly targeted for new moms, in particular if you're trying to stay up all night, your baby's not sleeping, and you're just trying to survive and not fall asleep, right? All risk is on a spectrum. And we have to weigh things, especially with respect to something like caffeine, where moderate intake is not shown to have any adverse effects. If you need that second or third cup of coffee in order to not fall asleep while breastfeeding your infant, you know, this is not my medical advice. It's not something that I would, I'm not your doctor. But as another mom, I would just say to grant ourselves some grace in the realm of reasonableness, right? With respect to caffeine consumption.
As long as you're not having, 2, 3, 4, 5 energy drinks a day, I think you're good.
Exactly.
Don't do that. But have another cup of coffee if you're struggling to stay awake. That is absolutely okay.
Exactly.
So let's move on to just quickly other substances. So illicit drugs and prescribed medication. So narcotics that are prescribed. What's the evidence on those guys?
So prescribed narcotics, you're always correct to ask your doctor about it, but many prescribed medications are perfectly safe to take while breastfeeding, especially for the duration of time that you would require them. We often send home our patients who have had cesarean sections with prescriptions for pain medication. And again, I have lots of moms that say, I'm not comfortable taking something that could pass into my breast milk, and fair enough, right? But the only, contrary opinion that I offer in that case is that pain management is really important to cesarean delivery recovery, really important to vaginal delivery recovery as well.
If you're in pain.
Right? And all of those things are also important to success or failure of breastfeeding, right? I shouldn't say failure as if not being able to continue breastfeeding is some sort of like a big judgment.
No.
But if maintaining your supply and being able to transition to a breastfeeding relationship with some longevity is important to you, then pain management is an important thing to consider as well.
Yeah, absolutely.
Now, with respect to illicit substances, things like cocaine, methamphetamines, PCP, they are considered contraindications to breastfeeding because there are pretty strong concerns about their impact on infant neurodevelopmental and behavioral outcomes, right?
Yeah.
The other thing, though, to keep in mind is that these are all street drugs, right? And so there are significant concerns as well, even in the context of research on these particular, drugs and their impact on children or their impact on adults, right? Is that there's unpredictable composition to something necessarily that you're getting from the street, right? And so even if we, let's imagine a world in which we did know that X grams of cocaine was safe, right? I'm not saying it is. It is not found to be safe.
Yeah.
But even if we did know that, it would be impossible for us to say that a drug that you're getting that is not commercially manufactured and put through stringent safety protocols to ensure the same dose in everything that you're getting, there would be no way to tell that would be safe.
You have no idea what's in it. You can't predict that.
Exactly. And the other element as well with illicit substances is that oftentimes people who are using illicit substances may use a few different illicit substances, right? They all have different clearance times, as we've kind of discussed, even with the things that are more commercially available, right? And they may have compounded effects that are not well studied and not well elucidated.
Yes.
And so for all of those reasons, we would consider illicit drug use to be a contraindication to breastfeeding. So we would typically recommend not breastfeeding if you were using any of those substances.
Okay, so take-home messages for everyone on this mini episode that we've talked about here. So breastfeeding shouldn't feel like walking on a tightrope. Most people can safely consume caffeine and occasional alcohol while they're breastfeeding. So that's just kind of my take-home message that I want everyone to know. Megan, do you have any take-home messages for everyone?
Yeah, I mean, I think I would just say that I hope that we can discuss these things more out in the open, right?
Yes.
I don't think that shame helps anyone, particularly not breastfeeding pairs, right? And being able to maintain an open line of communication between provider and patient about the impact of substances on breastfeeding, I think is super important. And if that means shouldering more accusations of
then we will
of signing off on drinking and driving, then we'll do it. Which, again, to be so clear, don't drink and drive. I don't recommend drinking and driving.
Oh boy! But we are here to talk about these things, to open that conversation, because not enough people talk about it, and these are things that moms want to know, right?
And on that note as well, if there's one thing I can leave everybody with, the couple of comments that really got to me a little bit, most comments, even misunderstandings, it was a little bit again, I felt misunderstood, but it didn't make me actively upset. But one thing that does, irritate me a little bit was the suggestion that providing this information somehow condones, poor behavior or excess illicit substance use or alcoholism, as was what was suggested. And I'm not even going to comment on the, again, somehow signing off on alcoholism as a concept or of anything of that sort, but we have to stop telling women that being provided information about our own bodies is somehow dangerous to us, right?
Amen.
You are owed the information about how behaviors may impact your body so that you can make an informed decision about how to proceed. And hiding that information because perhaps someone would feel that it means that alcoholism, for instance, is okay or encouraged is inherently paternalistic. And it's just not something that we will ever sign off on this podcast. You're owed good quality, reliable information, and we are happy to be the people to provide it.
That is why we created the Push podcast. We are here to talk about everything. so that you can make a better informed decision for yourself.
Absolutely.
Nothing is off limits for us. We have always said that, but it remains true today. And when you guys speak up, we're gonna talk about it more. We're gonna dive into the comments and the questions. So if you guys have more questions, please let us know. Make sure you're following us on Instagram and TikTok at the.push.podcast. That's where you can find all our clips and everything that we've been talking about today. But we hope this gave you a little bit more confidence with substance use and breastfeeding for your journey.
Absolutely. And if you still think that we need to take a biochemistry course, as some people suggested, you know what? Let us know.
Probably do.
No, I have taken enough biochemistry.
Okay, sorry. I probably do. I've also taken biochemistry. I just do not want to do that again.
I refuse. I've done it enough. I have done enough biochemistry, guys. I understand it enough. But what I was going to say is my shoulders are broad enough to bear it. Our shoulders are broad enough to bear it. I just want for us to be talking about it.
Yeah, that's the main thing.
All right.
Okay.
We'll see you next time.
Bye, everyone.